Hi, my name is Christina Claremont, and I will be discussing the topic of coercive paraphilia and specifically analyzing the origin and treatment of 4 different types. So first, what is coercive paraphilia? The term coercive refers to relating to or using force or threats, and paraphilia can be classified as a disorder characterized by intense sexually arousing fantasies, sexual urges, or sexual behaviors that last for at least 6 months. Whether or not coercive paraphilia can be classified as a mental disorder has been controversial because there is no clear definition as to what is acceptable or unacceptable with this kind of behavior. Today I will be discussing 4 types of paraphilia, which include zoophilia, voyeurism, exhibitionism, and telephone scatalesia. So what is zoophilia? Zoophilia involves gaining sexual pleasure from animals and choosing this form of sexual contact even when other sexual outlets are available. Zoophilia is considered coercive, assuming that the animal is unwilling in the behavior. Zoophilia is often confused with bestiality, which is a sexual behavior with animals without concern for their welfare, but those with zoophilia have reported a deep connection with the animals. This type of behavior has been studied, and reports show that 8% of men and 3.6% of women have sexual interactions with animals at some point of their lives. Within this percentage, 40 to 50% of this behavior occurs with people who live on or near farms. This behavior has been more commonly seen in pediatric patients. Although zoophilia is not illegal, it is a very controversial behavior that can compromise the animal's welfare. There is no clear treatment for zoophilia other than psychoanalysis, behavior and/or cognitive therapy, or drug therapy. Many individuals have guilt or shame about their behavior, so it is very difficult to treat this type of disorder in one specific way. Next, what is voyeurism? Voyeurism involves intense sexual urges and fantasies relating to secretly viewing an unsuspecting person who is nude, disrobing, or engaging in sexual activity. This can be considered paraphilic behavior only if this method is preferred over other sexual outlets. The common name for those with voyeurism are peeping toms, and this behavior is most commonly seen in heterosexual men who lack social and sexual skills. Methods of voyeurism include secretly taking pictures or videos of the victim and using this to gain sexual pleasure. There has not been much research on voyeurism, but it has been reported that 8% of people have been sexually aroused from secretly spying on others having sex. Treatment of voyeurism is similar to that of zoophilia. It includes cognitive therapy, which seeks to change the patient's behavior, behavioral therapy, which teaches the patient to control the impulse to view the non-consenting victim, and psychoanalysis, which analyzes the patient's unconscious to form a reasoning for the behavior. The third paraphilia that I will cover is exhibitionism. This is the reoccurring intense urge or fantasy to display one's genitals to an unsuspecting stranger. This is more commonly known as flashing and typically occurs in men who often suffer from depression, personality disorder, substance abuse, or have suicidal thoughts. This is often mistaken as someone's invitation to want to have sexual intercourse with the victim, but in reality it is an escape from intercourse because the flasher does not expose themselves to willing men or women, only to strangers. The sexual pleasure is gained from one exposing themselves and fantasizing about the horror or shock they cause the victim. This behavior is very common. In fact, more than 1/3 of all males arrested for sexual offenses are arrested for exhibitionism. Treatment for exhibitionism resembles those used to treat other paraphilic disorders. Drug therapy is a very common method where a patient may take a combination of antidepressant and anti-anxiety drugs called SSRIs. If this doesn't work, many males will take androgen, which can lower or block males' testosterone production. The final paraphilia is telephone scatalesia. This behavior includes making obscene phone calls to unsuspecting people. This can be considered a paraphilia because the acts are compulsive and repetitive, and the behavior will cause distress to the victim. This behavior is seen in both males and females who suffer from feelings of inadequacy and insecurity. The phone calls may include heavy breathing followed by masturbation. This is often seen as a form of sexual harassment or stalking. Recipients of the harassment are advised to hang up and report the call to their telephone company immediately. Almost all paraphilias are treated in a similar manner. For telephone scatalesia, psychoanalysis or psychodynamic therapy has been proven effective because it identifies underlying reasoning from the patient's past and works towards a solution. Also, hormonal treatments can reduce the male's testosterone production with men who have higher testosterone levels. Thank you for watching!